issue in our area has really been around since about 2002, 2003. And there's a very good reason for that. And in our area specifically, it was because of OxyContin. And I pick on that drug a lot in our area. That's when we started to see the prescription drug issue rise to the surface, and it sort of took on a whole new life. And this slide that I start with here, I put this slide up here with these little local paper clippings, and I imagine in your area you could probably find some very similar, especially the pharmacist that's not far from here, some newspaper clippings that mirror what I have up here. And the reason I picked these articles, these 5 articles, is this really drives home the nature of the prescription drug issue. So I'm going to talk about each of these articles. All right, so the doctors didn't have a large number of options or choices to prescribe to us. Flash forward to about a decade ago when the pharmaceutical industry was just booming, and they were creating all these new types of drugs that mimic, very, very similar, and I have a few slides here to sort of drive that point home. They mimic the effects of all of the so-called hard drugs. They're identical to heroin. OxyContin is legalized heroin, is all it is. It's exactly the same effect on the body and almost exactly the same effect on the brain. Methylphenidate, methamphetamine. Methylphenidate is one of the ADHD drugs, and it has very similar chemical reactions in the body that methamphetamine does. Adderall, Ritalin are very similar to cocaine. People will call them legal coke. When we look forward in time to the last decade or so, this pharmaceutical boom with all these different drugs that are available. Each of the different drug categories, with one exception, the hallucinogenic drug category, has an equivalent in the pharmaceutical industry. All right? So that's the first sort of head of the trident, is the sheer number of pharmaceutical options that there are. Okay? The second is us as a society and our social acceptance of these drugs. And the third part is the availability, not the sheer number of pharmaceuticals, but how, as consumers, how readily available this stuff is. I want to use